Right now at 10, as leaders struggle to lower the COVID counts, some doctors call for another lockdown.
Our backs are well past being against the wall.
Meantime, record numbers of new cases and deaths. And straight talk from Maui's mayor.
I'm beginning to get really tired of telling you or asking you to do what is right.
Plus, new information on the Kaka'ako gunman who died in a confrontation with police.
Kilauea keeps us guessing with another quake swarm at the crater.
And warm afternoon highs flirting with the 90s. What can we expect for the rest of the weekend? Details ahead.
From across the islands on KGMB and KHNL, this is your source for breaking news. Hawaii News Now at 10.
And first at 10, Hawaii's darkest day of the pandemic. The state reported 1,035 new COVID cases, along with 9 deaths. Both are all-time highs.
Oahu had nearly 700 of today's new cases, but both Maui and the Big Island were also in triple digits for a second day. The 9 people who died were all on Oahu, 3 women and 6 men, ranging from their 50s to their 70s. And they all had underlying conditions.
Despite all the major event cancellations and new gathering limits, medical experts say Hawaii's COVID crisis is about to get much worse.
Elected officials don't want to wreck the economy, but there's growing pressure for drastic measures. Ben Gutierrez has our top story.
Governor Ige does not want to impose another lockdown, but he said this week it may be needed if case counts continue to rise. Some physicians say the time is already here.
Our backs are well past being against the wall. We are now to the point where there's only one option, and that option is closing down, plain and simple. And the option will be closing our schools down.
Dr. Scott Miskovich, a senior advisor to the state's COVID task force, says Hawaii needs to shut down for 4 weeks to prevent the COVID counts from doubling in the coming weeks. That includes businesses, tourism, and, yes, schools. The Department of Education says 557 staff and students have tested positive in the last week. A chart of daily cases shows the rising trend. But the DOE is resisting calls to return to full distance learning.
And the data that we have that is telling us that there is no spread in our schools.
Honolulu Mayor Rick Blangiardi also does not want to go backwards.
We were not in favor of a lockdown. I don't believe the governor is in favor of a lockdown. And so we're going to proceed in every way possible to continue to work our way through this, all the while urging members of our community to get vaccinated.
Blangiardi hopes to bring the COVID counts down with more police enforcement on social gatherings, increasing vaccinations, and helping businesses turn away the unvaccinated.
We are going to implement a vaccine passport for restaurants and bars and gyms and a whole lot of other places, requiring both patrons and employees.
Government officials are doing everything they can to avoid a lockdown because of its impact on the economy. But Dr. Miskovich argues that a short-term shutdown would have a positive impact in the long term.
If we do it now, we can then go back to the United States, go back to the world and say, you know, we took care of it. We took care of our citizens. Now welcome back, because Hawaii is a safe place for you to visit.
Other doctors are pleading with the public to do their part by masking up, avoiding crowds, and getting vaccinated.
We need to do this for at least a couple weeks to get this curve under control, because if we don't, our healthcare system will become overwhelmed. And then those of you who need critical care for heart attacks, strokes, delivering your babies, whatever it may be, our ability to deliver that care may become impaired.
We have opportunities to do something, but I have to say right now that we're in dire straits.
Mayor Blangiardi is expected to reveal more details about the Vaccine Pass program on Monday. Ben Gutierrez, Hawaii News Now.
Thank you, Ben. New tonight, the ICU at Hilo Medical Center is operating over capacity with a record 40 COVID patients. 34 of them are unvaccinated. To meet the demand, the hospital opened a 16-bed overflow unit today in the extended care facility.